So this is an exercise I like to call the hip stretch in 3 directions. And I like to give this exercise to people who have really, really tight and limited hips. Obviously, limited hip mobility can put extra pressure onto the lumbar spine. But also, I find this exercise is very, very valuable when people have had some sort of disc issue and their hip muscles, the glutes, the hip flexors, things like that, become quite sensitive and like to grip quite a lot. So if you have excess muscle guarding in this area, these passive stretches can be extremely valuable. So the 3 directions of the stretch are into hip flexion. Just can you show us hip flexion quickly? Beautiful. That's bringing your knee towards your chest. Into hip extension, which is basically bringing the hip back. So Will demonstrates this by letting his leg hang off the bed. And hip external rotation, which is bringing the hip out to the side. Excellent. And just relax, Will. That's perfect. So the way we perform this exercise is really important. So we're going to start with hip external rotation, if you don't mind, Will. And all you're going to do, particularly if you're one of these patients who has a lot of muscle guarding in this area, you're just going to place your ankle on the the outside of your ankle onto your thigh here. And just let that other leg sort of stretch out very gently into this externally rotated position. And you're not going to force or push or even do anything. You're almost just allowing your body to recognize that this is a safe and comfortable position. So we're not sort of pushing into the leg, we're not trying to force the stretch, we're just relaxing and doing some deep breathing into the stretch. And I would actually recommend holding this position for a fairly extended period of time. 1 to 2 minutes tends to work best for people. So that's into external rotation. Then we're going to bring the hip into flexion, if you don't mind. So once again, only as far as is comfortable for you. You can either hold on top of the shin, like Will is, or some people prefer to hold the hamstring. Either is absolutely fine. But once again, really important, we're not tugging on that knee, trying to force the knee to the chest. We're just relaxing and breathing into this position. Once again, 1 to 2 minutes in this position. And then we're going to go into hip extension. So allow your leg to gently hang off the bed, only as far as is comfortable. And again, this is the one that tends to be the most sensitive, particularly in back pain patients. So just be quite cautious with this one. But you really want to just let go. Release those muscles. Think of it more as a letting go exercise rather than a stretch. So this, once again, 1 minute to 2 in the hip extended position. Thank you very much, Will. So that is the hip stretch, 3 ways. The way we do that exercise is as important as the position of the leg itself.